Every day we are faced with decisions. Sometimes the answers are obvious. Other times they aren't as apparent unless we actively apply ourselves. Dentistry exhibits patient advocacy in both psychological and physiological aspects. From initial consultations to post-op, there are plenty of opportunities to learn within the industry as there are to make mistakes. Here are 4 most common problems that lead to remakes. 1. Suboptimal tooth preparation. More favorable preparation practices include the avoidance of jagged edges, undercuts, and obstructed margins. This allows technicians to easily identify the margin in order to ensure a flush fit. In many cases, the conditions are less than ideal when prepping a tooth, making this an extremely critical step. 2. Poor impressions. Impressions provide an accurate snapshot of a patient's mouth to be used as a visual representational guide for interpreting a crown or bridge placement. Indicative factors of a poor impression include insufficient coverage by the impression itself, prematurely removing the impression material before it is fully set, or an improper bite performed by the patient. This part of the procedure is arguably the most crucial. Simply put, an insufficient impression will result in a bad crown. 3. Temporization and shifting teeth. To maintain an exact state of teeth until the permanent crown is placed, the temporization must not be overlooked. The teeth can physiologically shift up to 0.5 millimeters within a single day, rendering the initial obtained records useless if a temporary crown is out of occlusion or if the interproximal contacts are open. Temporary crowns are just as important as the final crown and will ultimately influence the structural layout of the patient's remaining teeth, hence affecting the final fit of the crown. 4. Selecting the proper material should be based on the translucency of the patient's remaining teeth. For example, if the patient's anterior teeth display a high level of translucency, selecting a porcelain material is more favorable where posterior crowns do not prioritize aesthetics. Shade selecting can particularly be challenging based on varying lighting situations. Therefore, natural light is preferred when choosing a shade. If the shade selection is still unobtainable, it is highly recommended the patient comes in directly to undergo a custom shade to ensure the most accurate shade match by an experienced technician. Even the most experienced doctors and clinicians can vastly minimize the chances of restoration remakes simply by executing the best industry practices, but the most important skill relies within communication. One has to be objective and open to varying degrees of professional ideologies and opinions to meet or exceed the outcome for any patient.
Visit vitalitydentalarts.com.